So this is the homepage that you get to when you go onto the platform. And if you can press at the top the sign in button, it will bring you to this page. And these are kind of the additional security bits that we've added in that Marcus described. So when you've entered your email and password, got the additional capture button. And then once you pass this, you'll need to do the two-factor authentication. So I think that's a real benefit that this new platform brings, that it's just added security and protects against invaluable access. So a note here as well is just at the bottom that you will need new credentials set up. So if you haven't already, you can't use the same username password as a previous system, but you can get set up if you contact us or your lead clinician. So what I've done is I'm now going to take you to this testing site. So all of the information now is just made up data, dummy data. It's not real patient information at all. It's just been created for the purposes of this webinar. So here I've done all the logging in and two-factor authentication before, and you can see that I'm logged in and I've been promoted to a doctor in this instance. But so we've just added me to Kingsmill Hospital, which is in Sherwood Forest, so part of Colin's team. So firstly, what I'll show you is you can see that we're on the organisation dashboard. So that's one additional benefit of this platform, is that we've entered in sub-trust or health board data entry, because we know that a lot of mergers have happened and those larger services sometimes have multiple hospital sites and they can be quite different from each other in some instances. So whereas originally we've kind of only reported and allowed data entry at trust level and health board level in Wales, now there's this type of organisation, as we've called it. So you can have multiple organisations within a trust or health board. So firstly, you can view all the staff at your organisation here, or you can switch to the trust level. And here it's just myself as a demo account there, but you're able to see the list of services users within your service. And then you can add people by clicking this button, fill in their details. It will go automatically to the organisation that you're clicked under, but you can select their role as a lead clinician or administrator there. So I'll just press cancel for the moment, but that's showing you how you can add new users to help with the data entry. And then there will kind of always be this button here that return to organisation dashboard. So that's your almost homepage as such. So then next, if we go to looking at the children and young people in your service, you can click this button on the right, and then that will take you to this audit submissions page. So here I'm currently on trust level, which is Sherwood Forest, but I can switch to organisation level, which is Kingsmill. However, here, if it was Colin, for example, logged in, he'd be able to see the other organisations, and you can flick between them. But if we just go back to Kingsmill, you'll see the list here. So the first step to adding a patient is to add a new child or young person via this pinkish button here. And if you click on that, it will take you to the demographic details of the patient, so the name, date of birth, etc. I'm not going to fill this out now, but you can imagine once you've filled this out all in, you can press save. And there's kind of filters here that it won't let you add a date of birth in the future, for example. It'll check that the postcode's a real one, that the NHS number is a valid number in the right format, etc. And also that there's not already a patient registered with that NHS number. So we've built in those validity tests here. So I'm just going to press cancel for the moment. But once you've completed that, the patient will then appear on this list. So this is kind of your case list for your organisation or trust. And you can see here different names. And again, these are just some dummy patients automatically generated for this webinar. So I wanted to highlight here the different kind of versions or progress that you have of the patients. So here you can see this is kind of grayed out, and that's because this patient has had all their data entered and has now submitted their record to Epilepsy12 by this button. But if you hover over here, you can unsubmit it if you wanted to make any amendments to the record, for example. But this just means it can help you track like You've entered all the data for that patient, it's ready to go and can be submitted. However, one thing that is different from this platform that we had in the other one is that you don't need to submit your records. So just automatically after the deadline is passed, we'll just take all the completed records. You don't need to do that additional step of locking and submitting to Epilepsy12. That's you had to do in the previous platform. But there is the option for you to help kind of track which records are being completed by pressing that submit button. So the next step is you'll see the first two records have a pink tick, and that means that the data has been completed, it's ready for upload, you've answered all the questions, whereas the ones below it are still blue and it says data incomplete, and that's because all the questions haven't been answered, but you can see on these how many have, so you can easily track your progress against each record. So what I'm going to do now is just select this patient here and walk you through how to complete their data entry. So firstly, there's kind of two buttons here that you can navigate to. First is the edit button or delete a child. So if you click on that, it will take you to the demographic details. So if you notice their name is slightly misspelled or you've put their date of birth in wrong, you can edit that here and then just press save. However, also you can delete a child here if you realise that they're not eligible for the audit. So that's also an option. So I'll just press save and it should take me back to this case list page. So then the next button you have is the audit button, and that's the main one for the audit entry. So if we click on that, it will bring you to this record page and you can see the details here. So currently, nothing has been filled out for this patient apart from those demographic details. But when you scroll down, you can see here all the eligibility criteria for Epilepsy12. And if you believe this patient is eligible, then you have to press this, I confirm all criteria present. And this, without doing this, you can't proceed for the rest of the data entry. But if I click that here, then that goes pink and I can then proceed to the next bit. So you can see the trust that it's under, the patient is under at the moment, and you can put in the first pediatric assessment form. So I'm just going to pick a date in January of this year, and then I can press set. Important thing is here that it asks for you to confirm the date because you can't change this. If you do make a mistake, you can contact Epilepsy12 staff and we'll help correct that, but it is important to try and get this date correct as it informs the cohort and submission deadline, etc. So I'm going to confirm that here, and you'll see then the cohort when they would complete their first year of care and the submission deadline is automatically populated here. So if we scroll back up, this is your kind of, on the left-hand side, your view of all the data tabs you need to complete. And as you can see, because we've filled in the confirm the eligibility and filled in the first assessment dates, you've got a pink tick here to show your progress. So then essentially we can work your way down to complete all the questions, but as it was highlighted earlier, you don't have to go in order. You can kind of jump around and pick whichever questions you want to complete and try and do this prospectively through the year as you gain more information through the patients. So I'm just going to walk you through a few examples and not complete the whole form now. But if we go to the multitaxial diagnosis bit, I'm going to try and add an episode. So here you can see add new episode, and then that will take you to further drop down. So you can put in the date that the episode happened. So if I just select today and press set, can have that an exact, approximate, or not known date. And then this one will disappear if it's not known. And then you can select an episode definition there. If I just keep going, and if you have a description of the episode, you can press yes here, and then you can write in this description and it should pick out 3 keywords for you. So if I just start typing a random description here, so you can see some walking has been picked out as a keyword. Sorry. So what, if I correct that, what you can say, I've just typed in a random description there, but it's picked out keywords at the bottom. But one thing to highlight that I've spelt memory impairment wrong there, but it's still picked out as a keyword. So I think that's quite a useful thing to highlight. And then you can kind of write a freehand description, what suits you. And then if I go save new episode now, it will bring us back to the top, but you can see that there's no tick there. It says incomplete data fields. So if I go and edit that, and I go down and I realize this question hasn't been answered. So I can click epileptic, select an onset, and again, I'm just going to fill out some random points and then save this episode. It should hopefully come up as a pink tick now. So that's your elements where you can see where you completed the question. Pink tick is yes, and these still blue circles are still incomplete, and you have those to go. And then similar things of going down the syndrome, causes, and relevant impairments, behavioural and education issues. So under cause here, it's going to highlight, we've got a list, however, it's not an exhaustive list. So currently we're just asking if you go on there and you find a cause isn't on our list, to please contact us and we can add it to the platform. And then hopefully we'll just build on our list and make it more complete. We've chosen not to have an other option for the cause because we found previously that sometimes the other option was selected despite there being a cause in the drop down. So it's the method we've got so far. So please do let us know and we can add some additional causes onto there. So then the last thing that I was going to show, if we go to the milestones tab, this asks you about the kind of professional and expert input the child or young person has received in their year of care. So we can select yes if they've seen a consultant paediatrician, and again that will go pink. And then it will ask for the date of referral and achievement. So if I just go back to April and then set that and do the same. For this date, and then you can pick a random service as well to add in. So now we've got lots of pink ticks there, which is great. And I'm just going to go and select some of these options as well, as you can then indicate their input to epilepsy surgery services. And the final question is about epilepsy specialist nurse input. So if I say no now. So you can see here that now we've got 2 pink ticks, but the others have been incomplete yet. And then there's 7 tabs which are trying to get the information on the first year of care for the child or young person. And then the 8th tab is this performance summary. So if we click on that, you'll get an overview of the 10 Epilepsy12 performance indicators, our KPIs, and you can see here which have been achieved for this child. So you'll see a pink tick if you've met the performance indicator. So this child has seen a paediatrician with expertise within 2 weeks of referral, which is great. We've got data incomplete for some of the measures at the bottom, and that's because we haven't yet answered the questions. So you can see that. Whereas these triangles to the exclamation point is where the KPI has not yet been achieved for the child. So here you can realise this performance summary will update as soon as the question is answered in the form. So if we go back to the milestones bit, I've kind of realised, oh, I think actually they have seen an ESN, or I filled in this form and then a month later they've kind of seen an ESN, I can go and change this back to yes, and it will ask me for the date of input, which I'm just going to set as today, or referral and inputs. And you can see the time to review as well at the bottom there. So now if we go back to the performance summary, you've now got a tick here. So you can see the real-time updates of that and the real-time information that you can get, which is really useful. So once you've gone through and completed all of these tabs, then all of this information at patient level, the KPI data, if we go back to the organisation dashboard, and you scroll down, you can see some information at your organisation of the completed patient records for your organisation and trust. A bit of information about the demographics of all your patients here, and some very pretty maps designed to show you where you are in the country and regions, etc. But here we have a clinician-facing dashboard. So this, all the patient information from those performance summaries get aggregated here to give you the KPI data at your organizational level right up to national level. So you can see here all the KPIs, and if you scroll down, you'll see the others. And if you imagine there's more data here, it would be a lot more information there, but you can see where you place against all the regional averages, and also where there's bits where you haven't completed data yet or you're not applicable. And then if you go down to the individual measures and we pick ESN, you can see just a snapshot of all the performance at all the different levels, and some bar charts at the bottom as well, which I won't show now. But these are really designed to, as Lucy said, make it easier to enter data onto the platform. We've kind of all got yes or no options, not a lot of free text, to try and reduce the time to enter a record for each patient, but also try and make the most use out of that data. So give you that real-time feedback in the performance summaries, and as live as possible feedback via these dashboards to give you regional benchmarking information, you can track QI, etc. So those are kind of a whistle-stop tour through entering patient data.